All right, ladies and gentlemen, to continue our lecture from yesterday, we stopped after we get information about how to examine the urinary system, and we realized that we have invasive and non-invasive techniques. Now we are going with some diseases or abnormalities or malfunction of the urinary system. The first and common complication is cystitis. As you know, this word composed of two words, cyst, which we mean it is a bladder, and itis means inflammation or infection. And this means infection or inflammation of the urinary bladder. And by the way, I need to give you impression about this cystitis. Cystitis is more common in female than male. So this is question in the exam. Why cystitis is more common in female than male? Because very simple answer. Because the urethra in female is short and the urethra in male is long. This is number one. Number two, the opening of the urethra in female located in the vulva, and the vulva is potential infectious area. So easy to get ascending infection. What we mean by the word ascending infection means infection coming from the terminal part of the urethra through the opening in the vulva and go up in the direction of opposite direction to the stream of urine. So it will be ascending infection. Very rare to be like descending infection, means it coming from the kidney and descend down through the ureter to reach the urinary bladder. So cystitis is very common. And we have, if you read in some books, we have very common of cystitis we call honeymoon cystitis, and this common to happen to newly married girl, which we call honeymoon cystitis. After that, we have another disease, which is acute glomerulonephritis. What is the word acute? Acute means all of a sudden. It is rapid onset. Not like the chronic. The chronic takes long time to happen. What about the word glomerulonephritis? We know that the unit structure of the kidney is the nephron. So inflammation of the unit structure of the nephron, which is in particular the part which is the glomerulus, like we mentioned before, so it will lead to this disease, and this disease is characterized by hyaline cast. When we do examination of the urine, it is diagnostic when we find hyaline cast and we find blood together at urine sample examination. Another disease, which is incontinence and nephrotic syndrome. What we mean by incontinence? This is very common to happen with newly born and also with old people. What is it? Is inability to control the flow of urine, incontinence. This is very common symptoms. If you are like caregiver, you notice that this is like most common problem facing people with caregiver. So incontinence is very important subject, and because you are so professional, and I would like to build up your knowledge. What is the point? The point is, if you ask the patient, do you have desire to go to the restroom, but you can't hold yourself till reach to the restroom? This is one category. The other category say that, no, I don't have feeling that I need to go to the restroom, and the patient pay on himself. So there is a very big gap between these two items. What these are, it is the patient feel the desire to go to the restroom, but he cannot hold himself, or he has no desire at all, so the bladder is away from nerve sensation, which is what we call neurogenic bladder, when the bladder is full of or it has some urine, it evacuates itself without control of the patient.
What if
So
he has,
incontinence is big problem, and we need to differentiate between these two situations. What's your question?
doctor, what if they have to, what if they have the feeling that they have to use the restroom, but they can't use the restroom? They can't urinate.
This is the problem due to the prostate. This is common in male due to enlargement or senile enlargement of the prostate. They have a desire to go to the restroom, and they go to the restroom, but they cannot pass urine. So this is like what we call urine retention or urinary retention. And it is most common in male above age of 50 due to senile enlargement of the prostate. Okay?
Thank you.
You're welcome. Another disease, which is nephrotic syndrome, it is non-inflammatory disease that allow protein molecule to leave the blood and enter to the urine. As you know, guys, when we learn together at school how we perform urine analysis, we mentioned that protein should not show up in urine normally. Normal person, they don't have to show your protein in their urine. So what's the problem? The problem is the kidney is inflamed and get like wide pores, and it allows the protein of blood to escape from the blood and go into the urine. And when we examine the urine, we find that a huge amount of albumin will show up in urine. And according to this, what happened? The body will get edema because there's no albumin in the interstitial fluid, so tissues will be like swollen, and people with nephrotic syndrome will be like swollen all over the body. Result in large amount of water, as you see, accumulating in the body and causing generalized edema. Why? Because we lose the albumin of the blood and interstitial fluid to be escaped through urine. So this is the reason. Any patient losing the albumin and it will be like lost with the urine, he will start to suffer from generalized edema. Be careful. Another, yes?
So when you talk about, it might be a stupid question, but the protein that you're talking about that's spilling or leaking, is that like protein that we eat, or is that just like liquid? Can you explain a little bit about that? Because when I went to the doctor, they said there was a little bit of protein in my pee.
Okay, this protein is not liquid. Protein is like tissue, or not tissue actually, I'm sorry. It is like material. And when we have urine, you find that there is cloud. There is cloud in urine. The urine is not clear like water or like fluid. There is cloud or something floating within a sample of urine. So this is albumin. This is the nature. It is a protein. So the protein is not liquid. Protein is particles, and these particles will show up as like threads, like patches, like floating material within the urine. You got it?
Yes, thank you.
You're welcome. Polycystic kidney disease. The word poly means many, and cystic means it is a cyst. So the kidney tissue will be replaced by multiple cysts, and this cyst will be filled by fluid. And of course, as I told you, when we have a cyst within the kidney, it will replace the normal structure of the kidney, and this will like minimize or decrease the number of the nephron. So the kidney performance will be also affected. And this can be like congenital, or can be like one single big cyst, or it can be like many multiple cysts. And we have a lot of pictures talking about this issue. I would like to give you some impression about this. Pyelonephritis, we know from the medical term that the means the pelvis of the kidney. What is the pelvis? It is the collection of the tubules to make like the calyces, and between the calyces we get the collecting tubules, and the collecting tubules will join together to make like the funnel shape pelvis portion of the ureter. It is one of the most common kidney infection, pyelonephritis. Again, itis means inflammation or infection, cause fever, urgency, dysuria, back pain, burning, nocturia, and hematuria. I need to review all of these medical terms together. What we mean by hematuria, Israel?
Hematuria.
Hematuria means what?
Bleeding. I don't know.
Fina, what does hematuria means? I can't hear you, Fina.
Sorry, I don't remember.
Okay. Reen, what is hematuria?
Honestly, I think I think it's blood and urine.
Correct answer. Very good. Hematuria means blood and urine. Correct answer, Reen. Thank you. What about nocturia, Melissa? Can you answer this? What do you mean by nocturia?
Is it when your urine's dark?
No.
Oh.
Nocturia.
I don't know.
Alex, what you think?
Is it when you go in the bathroom at night?
Very good. So it is a desire to go to the restroom at night. So nocturia, uria means urination. Nocturia means night. Of course, it is not necessarily night, but it is during the time you are sleeping, because some people now, they have night shift and they are like awake all the night and sleep all the day. So this is not applied for them, but it is nocturia if you have normal 3 breaths. So we woke up during night and go to the restroom. Thank you, Alex. Correct answer. What is dysuria, Charlie?
Is dysuria?
What we mean by dysuria?
Dysuria just like it's hard to pee.
Very good. It is hard to pee or pain or difficult urination. Very good. What we mean by the word fever? Kelly.
Elevated temperature.
Elevated body temperature, correct. Thank you, guys. So all of these are symptoms of pyelonephritis. After that, we have another big problem, which is renal calculi. What we mean by calculi? Calculi means stone. Okay, so kidney stone can, like, maybe very small, can be very big, like we call staghorn, or it can be like visible by X-ray, normal X-ray, or it cannot be visible by X-ray. So it varies from shape, it varies from the consistency, and it varies according to, maybe it is silent, sometimes it is silent, patient has no complaint, and sometimes the patient start to feel like pain or colic, and this pain and colic will be like accompanied by disturbed urine and like blood in urine, and sometimes it is like stop the secretion of this kidney if it is impacted in the pelvis, so the kidney will not going to evacuate its content of urine into the ureter, and we have to interfere surgically to relieve this obstruction. Renal calculi. Calculi is the plural for the word calculus. After that, we have very big problem, which is renal failure. And failure of what? Failure of doing the job. What is the job? We mentioned before, it is filtration, it is excretion, it is excretion, secretion, and filtration and reabsorption. So we have two types of renal failure, acute and chronic. This acute renal failure, like resulting from sudden stopping of the kidney function. This is happen very common during operations. Any surgery with like patients suffer from problem with anesthesia or bleeding during operation. So the kidney suffer from hypovolemia and the patient or the kidney stop immediately to work. So this is what we call acute. And of course, when we restore back the blood volume, the kidney will start again to work. But we have another problem, which is the chronic one. The chronic renal failure, it is like take long time to progress, and actually there's no recovery from such kind of failure due to like repeated kidney infection or the presence of obstruction or the presence of autoimmune disease affecting the kidney like nephrotic syndrome. It will be also a problem for chronic renal failure. We have another situation, which is stricture. What we mean stricture? Stricture means narrowing of the passageway that interfere with the movement of urine. So sometimes we have patients suffer from stricture in the ureter. So the passageway from kidney down to the bladder will be impaired. Or another patient with stricture in the urethra, like they have operation before, like this is happened in female with like forceps labor. So they have inflamed, they have trauma, so that urethra will be like narrow. So we have to do plastic surgery to overcome this stricture. If the kidney function is impaired, so the amount of blood urea will start to increase. Why? Because the filtering power of the kidney is not working. So what's going on? The blood urea is starting to increase. So this is what we call uremia. So what is uremia? It is increased uric acid and blood urea in the blood. And of course, this is like indication that we have to do dialysis, like we mentioned before. And this dialysis will lower the blood urea. When we do regular urine examination or doing blood lab, they have to report about creatinine and blood urea. When we look to the number of both of these two result, we have to judge that patient is kidney is function or function properly, or the kidney function is not working properly. So this is for uremia. Another point we have to focus on it, which is age-related body characteristic. When we get elderly, what is the changes that normally to be happen when we get such age, and what is the effect on certain system? So number one, incontinence seems to occur at both ends of the life. Like I said it is in the early life as a kid and with old age. As women age, the bladder sphincter are not always capable to control urine. So this is due to also previous labor. So the labor itself is a trauma to the bladder and trauma to the urethra. And according to this, the sphincter of the urethra will not be able to hold urine perfectly. and this is very common for female, and it is also result in when you have this experience, if you are moms and you get before in a case of vaginal delivery, you notice that like 1 week or 10 days after labor, the mother is unable to hold urine because due to the edema and the trauma happened to the vulva and affecting and reflecting on the urethra. The physical effect of childbirth and obesity may cause incontinence, and men experience dripping due to the prostate involvement or following prostate surgery. So there's like some drops coming after the end of urine stream. The urinary system, particularly the kidney, of course, are very important to welfare of the body. As we mentioned, it controls the acidity of the blood, and also it is necessary to keep our need of water and a lot of jobs on shoulder of the kidney. And the kidneys is also responsible to produce material which is angiotensin, and this angiotensin also control the blood pressure. I hope we are already done with this lecture. I hope everything is clear with you. If you have any concern or any question, let me know, please. Okay, I need you to focus on the following terms. Number one, what is polyuria? Polyuria means excessive urination or multiple urination. What is oliguria? This is the opposite.
Doctor, I'm so sorry. Is there a way for you to type those words out on the screen?
Okay.
Yeah, I don't know what to spell.
Thank you.
You're welcome. I make it in like two, not one word. I make it in two words to help you. Poly means many, urea means urination. Okay, what is the opposite of polyuria? It is oliguria. Okay, let me make it like two words. So it will be like this. Okay, so polyuria, the opposite to oliguria, and oliguria means what? Means scanty. Okay, means scanty urine. So this is first word I need you to know. Another one I need you to know is hematuria. What we mean by hematuria means blood in urine. Okay. What is the next one? Is albuminuria. What is albuminuria means? Protein in urine. Okay. What else? I need you to know the following. Ascending infection. We discuss this word, which means that infection coming from the vulva up to the urinary bladder. We need to focus on this word. Trigonitis. I make it also in 2 words. What trigonitis means? Infection of trigon. And I know you know what is trigon. We mean trigon, it is the triangle bounded by the 2 orifices of ureter and the urethra. Okay, and we need also to focus on this word. What this, guys? Glucosuria means sugar in urine. In case of diabetes, okay? For example, diabetes mellitus. Okay, so glucosuria. So all of these medical terms are of great importance. Glucosuria means sugar in urine. Polyuria means multiple. The opposite of multiple urination is oliguria. Hematuria means blood in urine. Albuminuria means protein in urine. Another one, which is what is oxaluria? Means we have oxalate in urine. Okay. What is oxalate? Some of like if you eat spinach or strawberry, so rich tomato, rich in oxalate, so it will show up in urine. Okay, and lastly, we need to know what we mean by uremia. Uremia, it is 2 words, means increase blood urea. Are you following, guys? So I need like all of these medical terms to be clear, because this is common to be asked in your exam. So take notes and be ready for this medical term. All right. Any question?
No, doctor.
Okay. Let me, I think it's still we have time. If you don't mind, we can start next lecture. What do you think?